Rajashree, let's say hello to you. Can we hear you?
Yeah, hello.
Hello, can you tell us about where you work, what you do?
I'm a respiratory physio and I work in Southeast Kent.
Okay, and what sort of patients do you work with mostly?
We do mainly respiratory patient. I run pulmonary rehab program.
Oh, do you? Yeah.
And we use a lot of elements of Buteyko, definitely.
What did you start using them? Did you?
With especially with getting them in a correct breathing pattern. And as just some of you have discussed it, slow breathing. And with some of the dysfunctional one comes up and says that they have blocked up nose, can't breathe through nose, do use the nose clearing techniques. Okay. And in general, we do a lot of those breathing retraining, slow down their breathing in longer expirations. So
what do you give people to take home? Do you give them something written or do you give them something recorded?
We do written ones. We do correct breathing technique, nose breathing, importance, benefits of nose breathing. We have got our own sort of a very short leaflet we give to every patient. I think looking at whether they're a respiratory patient, I think the correct breathing technique is important for all of us, whether we have a condition or not in general. So we are breathing too much. We do agree with it. And we do use an element in long COVID also. And I was just listening to the breathlessness bit. And I think I read a research which was done by the Imperial College. And it did say that why some of them still have prolonged breathlessness technique. Breathlessness reason is that they have found that the airway inflammation, the airway immune landscape is totally different from the vascular ones. So there's lots of things happening in the airway still, and yet your bloods are showing normal immunological response. So I do agree that there's so many things going on. The body has forgotten to turn off its immune response thing, and there's continuous inflammation going on in the airways. So which leads to, and yet your bloods are not showing those immune cells. I've just read one of them and it was quite interesting because we do wonder why, and it did say that it's because of failure to turn off the immune response, which continues to lead to airway inflammation.
Have you found that most people is sort of decreasing with time?
Yes, and somehow I felt you have to give them that confidence. I said, just wait for 2 years at least.
Wait for 2 years.
A long time.
Yes.
I know, and they do show changes, and it's been 2 years, and it's a very difficult one because everybody thinks it's like a symptoms of cold and cough and flu. It should be better in a few weeks' time. And I see a few long COVID cases, and I just said, you have to have more patience. Take as the day go by. And I would say, I'd give them that confidence that you will likely to recover your symptoms, but give some time. Yes. I don't know, we just thought I had in my head 2 years. I said, give that 2 years time and you'll definitely feel better in yourself.
I used to say that with people with Buteyko and say to them, look, it takes, the lungs sometimes have to replace themselves, and it takes these cells that perhaps are not, working well. It's that time for the whole body to actually replace itself. I think it's actually more like 5 years, isn't it, for the lungs, Claire, to replace themselves? Different like the blood, it's only 6 weeks. The red cells in the blood, it's only 6 weeks, but other parts of the body, it's a bit slower. But the body is working all the time, isn't it?
Yeah, it's taken a long time to where you are. You have to give more time to get back to some sort of normality.